from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us as we discuss one of the biggest risks to firefighters, which isn't often discussed, and what Sarasota Memorial is doing to combat that. Our first guest today is Dr. Richard Brown, the medical director of the Brian D. Jellison Cancer Institute here at Sarasota Memorial. Dr. Brown, thank you so much for joining us.
Thank you.
First responders, especially firefighters, we already know that they have a very dangerous job.
Yes.
But I was shocked to learn that they have such heightened cancer risks. So can you talk about what unique cancer risks firefighters face compared to the general population?
Well, first you have to think about all of their exposures. Okay. You know, burning buildings have lots of materials in them, and those materials give off all sorts of toxic, noxious fumes. And even though they may be wearing masks and everything, it's getting on their skin, it's getting on their uniforms and on their gear and everything. So there is exposure. I think there was like some sort of study even done after 9/11 that showed there were thousands of chemicals that were released when those towers went down. And there's just hundreds of chemicals that are released on any fire, and some of them are pretty noxious chemicals. I mean, there's something called PAH, benzene, there's a lot of particulate matter, there's asbestos. So to get these exposures, so that puts them at higher risk. So when you look at firefighters, they're at around a 14% higher risk of developing and dying of cancer than the general population. Now, the interesting thing is that even though they're in a risky business, the biggest cause of death for active firefighters is actually cancer, not from the actual having problems with the fire itself. So around 60%. Even that if you look at the average person getting cancer in this country, their age is 68. When you look at firefighters, it's 48.
Wow.
So they're getting it actually at a younger age.
Can you describe then how the Firefighters Cancer Collaborative began here at SMH and what specific needs it aims to address within the firefighter community?
So, Chief Desi approached us it was a couple of years ago towards the fall of, I think, 22. And we got together in January and talked to us about some of the unique problems that the Longboat Key Fire Department was having with regards to their screening and health programs. So we looked into it. And at the same time, we were discussing and starting to put up we have a high risk clinic. So we have nurse practitioner dedicated to looking at populations of people that are at high risk. And whether the high risk is, be it from genetics, family history, or environmental exposure, the biggest one, of course, being tobacco use. So we started saying, hey, this makes sense for us to actually collaborate with the fire department in this collaborative, because certainly when you look at their statistics, the risk of developing cancer is much higher, and the cancers they were getting, that we thought that there'd be some benefit to them in terms of what we could do for them.
You've spoken about the risks of firefighters compared to the general population. How does this initiative immediately help mitigate those risks?
Well, one is that we are well aware of everything that needs to be done for screening. That is what we do. So we have enhanced screening, appropriate screening. So some of the things that were previously done, not necessarily was the appropriate way of screening people. The best way is taking a history, taking a physical, doing an examination, looking at the parts of the body, and doing appropriate laboratory studies, radiologic studies, and making sure it gets done and making sure that they follow up with it. Because again, I told you that firefighters as a profession are fairly young, 47 on average. So you think about it as that a bunch of young, healthy people, and they don't really think that anything is going to happen to them. But yet they are at higher risk. So they have to be really, 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 really on top of things to make sure that they're doing everything to do to not only get caught early, but also prevent malignancies. Because the best way of dealing with cancer is either prevent it or catch it in its earliest stages. So that's what we're trying to do in this collaborative right now, is work with them in terms of ways of preventing it through, modification of diet, if, I presume most of them do not smoke, but also exercise and everything else that they need to do. But it evolved from that. So it's not just in terms of helping them prevent and catch cancer early, but also we started looking at all their other needs in terms of wellness, mental health, physical, and so we put together a whole program for them.
Are there any misconceptions about cancer risks among firefighters that you'd like to clarify?
Well, that they're not going to get cancer. So, I mean, again, cancer is usually a two hit thing. It's not just environmental exposure, though. Environmental exposure, if it's significant enough, can cause cancer, but it's usually an interaction between your genetic predisposition that we all inherit as well as exposure. Unfortunately, we don't know what their genetic predispositions are unless we take detailed family histories and do genetic testing. And that's some of the things that we have done for the fire departments is in the appropriate setting, we have genetically tested them to see whether or not they were at risk from their genes that they inherited from parents, but also the environmental exposure.
What role does education play, and what sort of things is the Brian D. Jellison Cancer Institute team doing to help educate firefighters about the risks through the collaborative?
Well, we've already had a number of talks and discussions, WebExes, and actually in-person meetings with them to try and educate them. But, in all honesty, they're busy. Trying to get them all together is difficult. Part of this, even this discussion we're having today is to further educate them. But we are going to be doing some event where we're hopefully it's going to be fun, that we're going to be educating them in terms of, their risks, what they could do. We're going to have people from all over estimation talks of what we could offer them in terms of risk reduction. We're going to do yoga and some other exercises, because it's not just, in terms of preventing cancer, it's about diet, it's about physical wellness, it's about mental wellness, and again, genes, as well as looking at your environmental exposures. I think the fire department does as a good a job as it can in terms of mitigating those environmental exposures. Unfortunately, they can't be taken down to zero. They wear masks, they clean their gear fairly vigorously, but there's nothing they could do. So it's about learning that you do need to have skin examinations. You do need to have your thyroid palpated. You do need to have your fit test for making sure do not have a colon cancer. You do need to follow up with your physicians, which is key, because if you don't follow up, there may be a problem.
So you mentioned preventative screenings. Everyone needs preventative screenings that are age appropriate. Being part of this high risk clinic that you mentioned, does that just mean that they have these preventative screenings earlier?
Well, it also depends, and not just earlier in time. For instance, that there are some recommendations that maybe in terms of mammograms and PSAs, certainly in some populations, they get screened a little bit earlier. But it's also the nature of the screenings to make sure that they are in line with guidelines and recommendations of the task force, as well as the American College of Radiology and a bunch of other organizations say this is the best data right now we have for the pertinent screenings. But it's also not just getting the screens and making sure they're getting done, but the follow-up and making sure that if you have something, it's addressed in a timely fashion. So I think one of the biggest things that we actually offer in this collaborative is access. So, and that's what we're trying to do. We're trying to give access to the firefighters so that if they need something, they can get it done in the most expeditious way. And we've seen that in terms of our numbers. So we've sent patients, firefighters who needed to have genetic testing, needed to have further radiographs, needed to have further labs, needed to even have a primary care doctor, and we've arranged for all of that to happen.
So those are all measurable. Are there any other measurable impacts that you've seen yourself, either in awareness, behavior change, early diagnosis, anything like that?
Well, I think there's an interest now. I think that it's caught on. We initially started with, Longboat, and then East Manatee joined. And we, in terms of this, and we're hoping other fire departments will see it as well.
Do you have any other goals for the collaborative over the next few years, aside from just adding on more fire departments to learn more and get that awareness?
Well, again, to me, it's about prevention if we can. We're opening up the cancer pavilion. We're going to have a demo kitchen in there. Hopefully we'll start teaching people how to eat and cook healthy. Hopefully we'll have some other activities that we could do in there in terms of stress reduction and other activities that could help them in their careers, and any other preventive programs that come out along the way. So we're committed to staying on top of this with this high-risk clinic and everything else we do. Whatever the data-driven guidelines tell us to do in terms of making sure people get the most appropriate screening and prevention needed, that's what we're going to follow.
Now, we've been talking about the Brian D. Jellison Cancer Institute since it opened and how the importance of having all of this cancer care under one roof. This initiative seems to me like just another benefit of having such a robust cancer institute at a community hospital.
We want to help this community get the best cancer care they can. And certainly, first responders like the fire department, it seemed like, the best group of people we could possibly choose to start partnering with to make sure this community does achieve that.
Before we go, is there anything else you want to add?
Well, we're really excited about all the programs we have, going to open up in the pavilion, a high-risk clinic. We're hoping that, in all honesty, with time, that we'll develop it further and that more firefighters, companies will join, as well as other community groups. We see this is the way to go. The best way of treating cancer, again, is prevent it, catch it early. But if unfortunately you get it, we're going to give you the best access you can to get the best treatment.
Dr. Brown, thank you so much for being with us. And our next guest is Longboat Key Fire Chief Paul Desi. Thank you so much for joining us.
Thank you for having me.
From your perspective, how did this collaboration even come about, and how's it been going so far?
Well, it came about because in the fire service, the cancer-related injuries as well as illnesses and death are on the rise in the fire department. And so we wanted to do something locally, and knowing that the Sarasota Memorial had an area where they were doing some research in cancer, we made contact with them, and it was great. They had open arms for us, and Dr. Brown and his team met with us, and we talked about what we wanted to do and what they could help us with, and it's been going great. When it led to Sarasota Memorial looking at our annual physicals that the fire departments get. And Longboat Key is one of those that signed up quickly, and we are working with the hospital with getting our physicals, which is part of the cancer research that we're doing.
How has your experience as a fire chief shaped your view of cancer risk in the fire service?
Yeah, it really has. I mean, I started back in the mid-1980s, and back then there was really no talk about it. I mean, we would show up to fires. Sometimes we would wear an air tank, sometimes you wouldn't. The dirtier you were, the dirtier your helmet was, the better off you were. People would say, "Oh, wow, look how good he's done in a fire. He's out there being a hero." And this whole program has taught all of us that that's not the case. You want to protect yourself. You want to wear your protective gear. We have personal protective equipment that we wear, including the air tanks and all. And we also want to make sure that we clean our gear when we get back out of any fire, because any fire has the smoke products that are in there that causes cancer.
So I know you said things have changed since then, but in your view, what are the biggest remaining challenges firefighters face in reducing their cancer risk?
Well, I think the biggest challenge is them having these firefighters understand that it is important to stay healthy. And when we say that, we mean the physicals. We provide physicals. The fire departments and locally provide physicals for firefighters. And the problem we found with the physicals is that the younger guys were not going out and getting the follow-up. So the physician would say, you need to follow up with this. I found this, or your blood work shows this. Or maybe it's time for a colonoscopy. Your history shows that. So what we have found is that these firemen, since we've been doing these physicals and doing these programs with the fire department, they're going and they are getting follow-ups. They're going back to the hospital and they're going back to their physician or what's nice about Sarasota Memorial is that they follow up for us. So like for my case here, I had to follow up for colonoscopy. Well, within 3 days, I was getting a colonoscopy. I didn't have to wait for that. And we've seen it with many other people.
How have fire departments in Sarasota and Manatee counties changed routines or culture or protocols in response to education and safety guidance? And how has this collaboration changed what Longboat Key is doing?
Sure. Like I said, the physicals was a big thing. I mean, letting the guys understand and girls understand that it is important to follow up. But also, we call it deconning. When you get back from the fire, you decon, you clean your clothes. And in Longboat Key, when we built the fire station, we added those type of systems in there. So when you go into the fire department after a fire, you don't go inside the fire station with dirty clothes. You don't bring any of that contaminant inside the fire station. You leave it out in the garage area, or the bay, we call it. And then you take your clothes off and you put them into a washing machine, and you take your fire gear that you wore at a fire and you put that into what we call an extractor. So both those things are being cleaned, and then the firefighter goes into a clean area, gets a shower, and goes to a second shower, and as we call decon, and then hopefully all those the soot and what have you that they gather up in a fire is out of their system.
What has the reaction been from firefighters themselves, both younger members and long-serving veterans, of course, regarding cancer risk and prevention strategies as they've been learning more and more?
Right. So, I mean, the hardest one for us is as you get older, you look at your health more. And veteran guys were fairly easy to convince to have these physicals done and to do all the things that should have been done. The younger guys, they don't do it. And we're geared toward trying to change that culture in the fire service, letting these younger guys understand the importance of getting these physicals done, following up, making sure your gear is clean, all those things, because it's all about prevention. We go on a fire. If you don't wear your protective gear, there's a chance you could get cancer. It doesn't mean you're going to get cancer, but it's a good chance you could get it. And it won't happen tomorrow. It'll happen years from now. And maybe you may not even be working at the fire department at the time. So making sure they take care of themselves now is important to us. And that's kind of the culture change you'll see in the fire service.
Yeah, I understand that, if you would think about it just yourself, if you're not involved in it, you would think, oh, maybe the highest cancer risk that they're at risk of is lung cancer. But that actually turns out not to be the case. Dr. Brown was talking about that a lot of the cancer risk is from what is on their skin or what is seeping into their clothes, things like that. So,
and that's correct. Testicular cancer, you get that. Skin cancer, we have found skin cancer in our department has been on a rise. So we have implemented brim hats they wear out in the sun. So they, even if they're normal uniform, wear that to protect their face and what have you from the sun. So yeah, we when I have our Marine Patrol guys go out, they wear long sleeve shirts, making sure they wear the lotions and the protective gear that they have.
You talked about how you were able to get in for your follow-up very quickly. Are there any stories you want to share about how the collaborative so far has affected individual firefighters or families?
There are several stories on that, but one particular one, I got a phone call from the union. We all are in the same union, Sarasota, Manatee, Charlotte County Union. And the union president told me, hey, listen, we have one of the firefighters, was a female, had a physical, and the physical is showing that she has something with one of her breasts and that there's a shadow in there. And she's contacted her physician. The physician has given her 3 months to get in here. And she said, she can't wait 3 months, anything you can do. And all I did was make contact with Dr. Brown and his team. And within the 3 days, she was over at the Cancer Institute being checked. And luckily it was just what they said, a shadow.
What advice would you give to other fire departments or regions interested in launching similar efforts or joining in on this? I understand from Dr. Brown there's interest from other departments in getting into this collaborative so that it can impact more firefighters. Sure,
there's a lot of departments locally. Manatee County, Sarasota County, and we're hoping Charlotte County will be interested in doing the physicals like we're doing. And it's not just for cancer, it's for everything. But it's a Cancer Institute. They're the ones leading the cause on this. The thing I would tell other departments outside this area is don't be afraid to make contact with your local hospital. All it did was for me to make a phone call and say, can I meet with somebody at the hospital? And all of a sudden, this is what we have today. And it's been great. So I would tell the other departments, don't be afraid to contact somebody and ask them. They can contact us and we'll tell them our story.
And Dr. Brown mentioned that one of the things that's the biggest part of this is not only just the physicals and getting into exams, but also just the education surrounding it and letting the guys and gals in the fire department know these are the reasons why you need to be a part of it. Have you noticed that there's a heightened awareness and that people are taking part in these educational seminars?
Right. So what we do, we have an incentive program at the fire department, at our Longboat Key Fire Department, to where the hospital provides us the education components, meaning they'll have a doctor speak on gastro issues. And we'll have in order for the firefighters to get the incentive, they have to watch so many videos of this cancer prevention. And once they reach that goal, which is all of them, they have to watch all of them. Once they reach that and do it, then they get an incentive with a day off, which is part of the wellness, getting the physical, follow-up, all those things. So there's an incentive of doing all these things. And the incentive is you get a day off if you do this. Actually, it's 2 days off a year. So I'm telling you, if anybody wants to talk to me about this, this partnership with Memorial has been terrific. I mean, honestly, really has. And I couldn't have asked for a better partnership.
What are you most hopeful about for the future of firefighter health and wellness locally and nationally?
Right. So I think that our hope is as the firefighters get trained or should more say educated, that you'll see a decrease in the amount of cancer that are out there, because it's all over. I mean, there's lists. The state of Florida covers firefighters, 21 cancers they cover. And it's important for us to know that it's not, like you said, it's not just lung cancer. It's a lot of other things. I mean, skin cancer, we have found in our department, skin cancer and thyroid cancer were one of the areas that we were concerned about. But our hope is, as time goes on, even with my kids who are firefighters, I mean, and they're young, I hope that they all understand that eventually we'll see a decrease in cancer.
And what's your hope for this cancer collaborative with the Brian D. Jellison Cancer Institute at SMH? Do you have any hopes to how it's going to grow, or how else, other things you'd like to do with the collaborative? Sure.
I mean, I have all kinds of ideas I like to work with them on. I know the hospital is open to this. But I think right now what we want to focus on is trying to get the physicals that the firefighters get, other departments are getting, to join in with what we're doing. And I think if they see what we're doing as far as the physicals and the follow-up, because like I said earlier, the biggest thing is firefighters don't follow up. You can tell them, but there's no follow-up. And that was one of the big things that drove me to do this, is where Memorial says, Dr. Brown says, we'll follow up. And they do. They follow up. Before I got back to the firehouse, I was getting a phone call on my cell phone from the gastro at First Physicians to say, hey, we got an appointment for you. You're ready to come in. So my hope is, and the future is let's get these physicals done first, and let's expand from there.
Absolutely. Well, thank you so much for joining us, Chief Des.
Thank you. I really appreciate it.
If you liked this episode of HealthCasts, please like and comment, and visit smh.com/podcast to listen to more experts talking about health issues which matter to you. And as always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.